I am Bea, the CEO and co-founder of Uniquely Health, and today I have the pleasure of having our exercise scientist Sabine, our dietitian Anna, and our GP Jim join us for this talk, which will take place as well in the form of a Q&A on Are You Choosing Long-Term Health? Before we get started, I just wanted to briefly introduce Uniquely Health. We are an online wellness and health business, and what we do is we help people through our service to towards achieving their health goals. We provide really personalized, data-driven and holistic approach. And the purpose of today is just to share with you some knowledge and some tips on hopefully raising awareness on why our long-term health matters so much. So on that note, over half of poor health and early death is linked to lifestyle factors that we can change. And I'd love to pass over to Jim, our clinical lead, to explain how crucial is lifestyle in shaping our overall health and well-being.
So if we think about health as being a broad concept, health includes our mental health as well as our physical health, and is perhaps more easily measured. Well-being is a bit more subjective, I suppose, and looking at how we feel, but they're closely linked, and our health may influence our well-being. But our lifestyle is all the aspects of what we do across our lives that will influence your health and well-being. And the sort of things that might include are the food that you eat, the movement that you get, the exercise that you do, the sleep that you get, the stress that you're under, the many different ways in which you're pulled across your day. And the UK Western lifestyle is fairly toxic in that way. We have access to very sedentary jobs sometimes, and we have a lot of options of very poor food choices. And the jobs that we have often push us into very stressful situations and very poor sleep. And again, social media will act on that as well to not improve your stress or your sleep patterns. So lifestyle can have a huge impact on how you feel, and that may impact on your well-being, and it can also impact on your physical health and cause certain health conditions, which we'll come on to.
Thank you, Jim. And you touched, just going on there at the end, you talked about it can also impact our physical condition. Sabine, from an exercise perspective, what have you seen in terms of lifestyle impacting our health and well-being?
Yeah, it's a good question. So I think Jim's touched on it nicely there, the fact that we are living in modern day life now, and there's been such a big shift in the last 50 to 100 years in our general approach to what our day-to-day activity looks like. For example, lots of people adopt more sedentary lifestyles. People spend long working hours sitting at a desk. And traditionally, even just using the desk as an example, people adopt a sort of slightly slumped, rounded shoulder posture where you end up losing some of your core strength. We're not moving as much. We're not kind of getting as much general activity throughout the day, not walking as much as people used to 50 to 100 years ago. And as a result, that's having a really, really big impact on our health. Lots of research shows that people who walk more, who are getting more day-to-day activity, do generally have longer lifespans and generally longer health spans as well. And kind of just to differentiate the difference between health span and lifespan, health span is the number of years that you spend free of chronic diseases. So it's all very well living to 100, but if you're living to 100 in very poor health in the last 30 years of your life, it's not the quality of life that we'd like people to lead. So really, we are here to help people be as healthy as they can for as long as they can, and ensuring that people are living in good health into those later years as well.
Great, thank you. So could you help me understand what is the link between this kind of being inactive right now, and I'm sure eating less healthy diets as well, and preventable diseases? What is the link there? Jim, do you have something there?
So there's various preventable diseases that can be triggered by poor lifestyle choices. So people who have poor sleep and high stress can end up with high levels of stress hormones, and that can lead to weight gain, which leads to obesity. Obesity can then lead on to things like heart disease and stroke. And if we look then at the sedentary lifestyle, a sedentary lifestyle can lead to obesity as well, but it can also lead to you not having quite so good musculature, and that will mean that your strength going into later life will be less, and so you may be more likely to get things like osteoporosis, or you may be more likely to get injuries as you get older and just have poor mobility, not be able to walk as far as you get into your later life. And the sedentary lifestyle and diet sort of linked together can lead to other conditions like type 2 diabetes and high cholesterol. And both of those conditions have long-lasting damaging effects on your health and lead to things like heart attack, stroke, and also things that people perhaps don't consider, like dementia. So dementia is a well-known problem for people who have heart disease and obesity. And the inflammation that is caused by those problems in your body is what is damaging the brain as much as the heart.
Thank you. And Anna, from a dietetic perspective, hearing about type 2 diabetes and high cholesterol, what do you see in this, and how are people's current decisions impacting their long-term health in that perspective? What is the link there?
Yeah, very good question. Thank you. And I think Jim has already made a good start on it. As a dietitian, we see that nutrition plays also a very significant role in this preventing and managing chronic conditions. So a healthy diet can help reduce the risk of developing chronic diseases such as heart disease, diabetes, even certain types of cancer. And that is because by consuming a balanced diet that is rich in fruit, vegetables, whole grains, lean proteins, healthy fats, the individuals then can maintain a healthy weight, but also regulate things such as their blood sugar levels and lower their cholesterol levels as well. And to add on that, certain nutrients also have been shown to have specific benefits for managing chronic condition. So, for example, omega-3 fatty acids, which are commonly found in fish and nuts, can help reduce inflammation, for example, and improve your heart health. Whereas things such as high fiber rich foods can aid digestion, and you're then on the other hand, you can regulate your blood sugar levels better, which are things that can be better for individuals living with diabetes or pre-diabetes. So I think overall, making nutritious food choices and following a wholesome, well-rounded diet can play a very vital role here in preventing the onset of chronic conditions and managing existing health issues. But it's also important to know who to trust. So it's kind of the key is to be able to get the right information from people that have the knowledge, that are professionals in the area, and that then they're able to help you develop a personalized nutrition plan, but a generally holistic plan to tailor it to your individual needs and health goals.
Thank you. So it sounds to me like there are a lot of things that we could be doing right now that could impact our health in the long term, both positively and negatively. And at Uniquely Health, we recently commissioned some research which identified what were the top barriers from people adopting a healthy lifestyle. And the results were lack of motivation, difficulty in finding time, and prioritizing other things such as family and career. And I think you touched upon this a little bit earlier on, Jim, in this conversation we're having. So from your guys' expertise as clinical experts like you are, what are things that people could be doing now to bridge this gap between recognizing the importance of adopting healthier lifestyle choices and achieving that? And how do people work around the lack of motivation and the lack of time?
I think that the first thing is realizing that you can't lead an unhealthy lifestyle for long before it starts to have an impact on your health and well-being. So I think having the knowledge of what a healthy lifestyle might look like, and that's what we help people to achieve, I think, that's a good step. But you then need to realize that you have to work it into your daily life. Otherwise, you're going to get these common conditions later in life. So whilst it's important to look after the family, to look after your job, to look after elderly relatives or young children, whichever it is that you're prioritizing, we also know that those people, your young children, want you to be around in good health later on in life. And so the time that you put into having a healthy lifestyle now, and sort of tackling those bad habits that we all fall into and are so easy to pick up, that pays dividends later in life and will affect both you and your family.
Thank you. And I think you just touched on, you both have spoken about this, about the health span. So would it be possible to, from your expertise, to explain how uniquely health helps people exactly in that in a bit more detail? Sabine, it'd be great to hear from you.
Yeah, sure. So again, going back to a recap of what health span is. So health span is the number of years that you live free from disease. So for example, if you were to develop quite a debilitating chronic disease such as type 2 diabetes at an early age, that would kind of be considering taking away from your health span. You may still live for a decent amount of time, but you may be living, in a slightly compromised quality of life. So we want to get people to live as long as they can in as good a health as they can. Now, in terms of what we can do and help with at Uniquely Health is really influencing and creating behaviour change that's going to help you live a healthier, longer life. So, for example, if cardiovascular disease is one of the elements that's coming up. You might be at risk of cardiovascular disease due to a family history, or you might be showing some symptoms or some signs that you might develop it in the future. Now, we know from an exercise perspective that exercise is very good for managing your blood pressure, both in the short term and the long term. We know that a combination of diet and exercise is very good for maintaining and for managing your cholesterol levels, and it can actually help to reduce your cholesterol levels. We know that there's also a significant role in your cardiovascular health and your cardiovascular fitness. So you can start to kind of see the picture, the bigger picture, and the dots that join up to promoting like a healthier, longer life. Because if we're able to influence those risk factors from an earlier age, say, for example, you started at the age of 40, rather than kind of waiting until it got too late and you were at very high risk of having a heart attack, then you're much more likely to kind of be free from having a big cardiac procedure or free from other complications later in your life. So I think the biggest thing I'd like to kind of get through is investing in your health now at an earlier stage is much better than waiting until it gets too late. Because I think all of us, speak on behalf of all of us, we've all come from different backgrounds where we've seen the consequences of people who don't look after themselves and people who wait until it's too late. And it's much more difficult to fix a problem when it's already a problem rather than to prevent it. But I think that's the big shift that we need to go through in the healthcare services and in healthcare as a whole. We need to think much more of prevention and, like Jim said already, how that looks in terms of looking after our families. It's all very well living a very busy lifestyle now and not putting your health and your health as a priority, but what does that mean for the future? So I think forward thinking in 20, 30, 40 years time, what do you want your life to look like, and how can we do the best now to help us later on as well?
Thank you. That's very motivating to think about it in the sense of what can we be doing now? And thinking the decisions we make now are really for our future. With that in mind, what advice would you give if someone was just to take home something from today and say, right, I'm going to start doing this? What would it be? Anna, it would be great to hear from you.
Thank you, Vi. This is a great question. I think there's a lot of things certainly you can do with nutrition, as with the other domains in someone's lifestyle. We know nutrition plays a key role in shaping our health and well-being. If I were to give and pick one tip, that would be trying to focus on incorporating a full complement of essential nutrients, and by that means learning what are the main food groups, what nutrients they can give you, and what will be the best options for you, depending on your lifestyle, the availability you have around you, the seasonality of the foods you get, your needs and preferences, such as things like cooking, who helps you with that, and how you can easily add one extra thing a week or two to get these extra nutrients from the food, instead of replicating the same foods every day or every week that you eat.
Okay, great, thank you. Sabine, what would be your one takeaway tip?
My one piece of advice, again, as Anna said, there's loads that you can do, but my one piece of advice is, if you're not already doing some form of resistance training, to aim to do 2 resistance training sessions per week. What I mean by resistance training is any form of movement where you're essentially using either body weight or a weight in the gym, or resistance bands to resist your muscles and promote strength. And we know that there's so many benefits to your health, including cardiovascular improvements, improving your blood glucose levels, improving your heart health, and many, many more. So I'd say resistance training would be number 1 priority.
And Jim?
So I think just being curious about your own body in this area. Like a lot of the conditions that we've talked about here, like diabetes and high cholesterol, you won't know you have them until you have a blood test. But so maybe having a health check might be the thing for you. But we can also start without using blood tests. You can look at your weight, your BMI, your body mass index, or there are smart scales that can look at your body fat percentage. There's lots of data out there that you can get on your smartwatches and smartphones and smart scales. But talking to people like us is the way to try and understand that data and how that can relate to lifestyle changes you can make.
Okay, great. So what we have a health checkup, do some resistance training, and eat a varied diet. And to confirm, this is something that if people were to work with you, it would all be covered. And it is at the philosophy of Uniquely Healthy. Great. Thank you so much for your time today, and for sharing more about the importance of how our decisions that we made today, if we choose to work out or not to work out, what we eat, and how we look after our general health can really be impacting our long-term health. And there is a really interesting piece of food for thought there, which is health span versus lifespan. So it's great to hear your practical tips and to hear the importance of it. Thank you so much for your time, and thank you to our audience for joining in. If this has resonated with you and you'd like to find out more, please book a complimentary call on our website. You'll speak with one of our experts, and we can see where you're at and where you could potentially improve and help you achieve your health goals. All our plans and services are completely tailored to you and really work around your lifestyle, because as we've discussed today, everyone's lifestyle is completely different. Thank you so much to everyone for your time.
Thank you.
Thank you.
Thanks.